we'll go ahead and start because we've got a series of talks today and I'm not allowed to run over time. So welcome to the Dementia Living Well event. This is, I think, the third event we've had. The first one was in Altrincham, the second was at the fire station in Sale, and this is our third one. And there is a group of very enthusiastic people across Trafford, and Shan coordinates us all to help at these events. And the ambition for these events is to raise awareness of dementia and memory loss symptoms, and to help people find the support which is available, and to understand issues about memory better. So I am Dr Liz Clarke. I'm a GP at Washway Road, and I have been over the last perhaps 5 years chairing the Trafford Dementia Strategy Group. It is a group which brings together organisations and individuals who are interested in dementia and who work in that area. So it includes Trafford Public Health, Age UK, the Greater Manchester ICB, Trafford Social Care, the Memory Services, the Neighbourhood Leads, the Carers Centre, our hospital colleagues, and importantly, it contains some patients and carers of people who have dementia, and I'll come back to that in a minute. The strategy group works across all areas of dementia care, from raising awareness of preventing dementia, and that's something which is actually quite a new thought. The Lancet Commission, I've got some of these in on the desk, the Lancet Commission published this in 2024, and it showed that of the risk factors for dementia, 45% of them are potentially modifiable. Now that doesn't mean we can prevent 45% of dementia, but it does mean that there are a significant number of things we can do to prevent dementia. And you've always heard from your doctor probably about preventing heart disease and stroke. Well, now we can also give advice on preventing dementia. We're also involved with making sure that people in Trafford get an early and timely diagnosis. That's what our ambition is. And of course, anyone who's living with dementia or memory loss understands the need for quality support services and the need to live well with dementia. Because although dementia is a cruel illness, it doesn't take the entire person away. There are still parts of that person still there, and it's about looking and developing and making sure that the parts of people that still function well can be enjoyed by the individuals, which is why music and all of these things and singing and many things are really good and enjoyable for people who've got even advanced dementia. And of course, when it comes to the end of life, there are a lot of important things when it comes to dealing with dementia, such as getting your lasting power of attorneys in place and all those legal things. They actually need to be done much earlier in the journey. Now, in Trafford, we're also supported by Dementia United. Dementia United is a Greater Manchester organisation which supports all the all the GM localities, of which Trafford is one. There are 10 GM localities like Bolton and Manchester and Salford, and they're all supported by Dementia United, and they have set standards that they want each locality to meet, and these are called the Dementia Quality Standards. If anyone wants to know more about them, come and ask me. In our group, we have chosen various priority areas to address, and one of them important ones is that we want to increase patient and carer involvement in the group. Now, we have done this to a small extent, and it's very good to have people in the group with lived experience, because no one knows how the system works better than those who've had to go through it. And they can then give valuable feedback, because sometimes services feel that they're performing well when actually maybe they're not performing as well as they think. We also want to promote brain health, which was what I was speaking about earlier. Trafford actually has the lowest diagnosis rate of dementia across Greater Manchester, and we were below the England average, but we have over the last year gone now above the England average, although we're still the lowest in GM. And this is a bit of a mystery because we do actually have one of the highest elderly populations in GM. So it is important, if you think you have memory symptoms, to speak to your GP and ask for further advice. We also like to get feedback and improve awareness, and that's why we are here today. And also increase completion rates of dementia care plans. You may see, if you've got dementia, you should at least see your GP annually and discuss how you're getting on with your dementia. And also to improve awareness of advanced care planning. That's just a slide which shows the 45 potentially modifiable risk factors, which are different at different stages. In early life, it's about having a good education. When you get to our stage, we've had what we had, but a lot of us in Trafford have been very blessed with a good education. In midlife, it's dealing with things which are the traditional cardiovascular risk factors, your blood pressure, your cholesterol, keeping active and trying to maintain your weight, not smoking, managing your diabetes, all the same things. Sometimes I think that patients must get sick listening to doctors saying the same things over and over again. But then I thought, isn't it good that we only have one message and it's not 100 different messages? So it's the same recipe for everything, which is good, win-win. In later life, things like social isolation can impact on dementia symptoms, and it's really important to keep yourself out there and keep socially connected. Again, vision loss and a bit earlier hearing loss are other important things to consider. And actually there's been a study published about the shingles vaccine, which was done in Wales, and it has shown that people who got the shingles vaccine 7 years later had a 20% less risk of developing dementia over 7 years. So if you get called for your shingles vaccine, don't go, oh no, I don't like these vaccines. I think take all the help you can get. That's my philosophy in life. Take all the help you can get. So when we come to looking at services and what services we need in Trafford, the voice of lived experience is really important. And that's why we are keen to have people with real experience come to our Dementia Strategy Group and give us feedback. We meet every 3 months. Sometimes we meet face to face, sometimes we meet online. Lee at Age UK can connect you in. I'm on the first stall in there, so if you're interested, come and chat to me and we can get you connected into that group. You don't have to come every time. It's kind of free and easy. If you can't come, you come. If it doesn't suit you, you don't have to commit. So it's not an overcommitment. So, any questions? I'm not sure how I am for time. Someone can keep me.
10 minutes, yeah.
Oh, 10 minutes. So we've got 10 minutes for questions. Has anyone got any questions they want to ask?
You said about the GP that they should see somebody, take somebody to see them annually. Mm-hmm. That's never been suggested by the mum or by the GP or anything like that, although they are aware, and I've spoken several times to them. So is it fine if I went, or my husband and I, who are looking after, should we be able to go and speak to the GP without my mum, or do I need to take my mum there?
Well,
she gets very defensive if she's there as well. Yeah.
So what is really helpful and important for GP records is if your mum gives permission for you to speak to the GP on her behalf. Now this is why sort of forward planning is quite good, because if you've got severe dementia, someone might not have the capacity to do that.
Yeah.
And then we get...
You've got power of attorney. I've had power of attorney for a couple of years.
So you're organised.
I would
That's
definitely
great.
say get it for health and for finance.
Yes.
I deal with all the finances in all the appointments now.
Absolutely. So if you haven't done your lasting power of attorney yourself, I've done mine fairly recently. I probably should have done it before, but I've done mine fairly recently, because it just makes everything so much easier, because it allows, if the person has lost, it only comes into effect when the person loses capacity. So if the person's not able to make decisions for themselves, then they have said early who's allowed to make decisions on their behalf. So then you can, if your mum's lost capacity, then you can go and speak to GP on her behalf. That's not a problem. The GP will want to see, I think it's a number that you give them for the evidence that you're...
They've got. I took copies to them. You've got, they've got all the information and copies of it.
If your relatives in that in-between zone, where they might have capacity about some things and not capacity about other things, if they speak to the GP and give the GP permission to speak to you or whoever, then the GP can record that on the records that they've given consent to share third-party information. And it makes it so much easier. And with all my patients who have a diagnosis of dementia, I try to collect that information, because you can imagine if a blood test comes back and it's not right and it needs action, there's no point in ringing someone with dementia. You need to know who the carer is, and you need to have their permission to speak to them.
I'd also suggest as well beforehand that you get, because I did this with my mum with utilities, because she didn't like phoning up about the bills and things like that.
Yeah.
And she went on the phone and whenever needed to do something, she actually spoke with them and they actually had her permission registered.
Yes.
That she'd given permission for me to discuss things with them. Like I've just been on to BT this morning because she keeps nuisance phone calls really to the dentist. 97 in the last bill, 3-month period, and I'm trying to resolve that. So that, because they're working. For them, they're very good about it, but getting that done as well where you can with regards to utilities and that sort of thing. The permission's on the system, they will speak to you as she gets worse.
Now, when it comes to support with dementia, I've got a little leaflet here which just summarises some of the organisations, but Trafford Carers is important if you're a carer for someone with dementia. Obviously Age UK provides all our post-diagnostic support in Trafford, so when you go to the memory team, you will then automatically be referred to Age UK, and you might think, well, I don't need any support at the moment, but it's probably worth having an initial conversation with the dementia advisors there so that you know what's available even later on when you might need it. But at any point you can contact Age UK and say, look, I or my mother or my father's got a diagnosis of dementia, I need some advice and help. And they know what's on across the borough as well. And also companies like Trust Care, where for pendant alarms, for devices, that they've got devices that speak to you, say close the door or turn the cooker off, or other things that I don't even know what they are, because I'm not, although my granny had dementia when I was a child, I haven't recently gone through the system myself, thankfully, yet. And therefore that's why people who have gone through the system in Trafford are probably the most knowledgeable on any topic you care to bring up.
Is there a central repository for consent for somebody else? So you speak to your GP and arrange for someone else to be able to talk to the GP on your behalf, and then you have to do it again for BT, and then you have to do it again for British Gas. Is there a central place within the government?
No. I mean, GP systems and NHS systems are not even linked up.
Yeah.
Hospital and GP systems are not even linked. Never mind GP and BT. No, you'd have to go through it, I guess.
So is anybody looking at that? Is there a government body that looks at that and thinks, actually, we've got a growing dementia problem here?
Well, that's something that you could raise with, say, Dementia United, because Dementia United is a GM. So Greater Manchester is a massive area.
It would be a national thing, wouldn't it? It wouldn't,
Do you
it
know,
wouldn't be any local
almost
thing, it's
all
a national thing.
almost all national things tend to fail because you never get anybody.
But it wouldn't work unless it was national, because BT aren't necessarily in Greater Manchester.
Yeah.
You know, and British Gas and whoever.
Well, do you know, a few years ago there was a dementia czar,
Yeah.
but I don't think we've got a dementia czar. No. I must be close to time, am I
Yeah,
close to
I
time?
think you are. Are you?